So, a little bit about polycythemia. It is an excessive or abnormal increase in the number of erythrocytes. We said that erythrocytes production is controlled by erythropoietin, and a higher number of erythrocytes will increase the oxygen carrying capacity of your blood. It does thicken the blood, which does put a strain on the heart. So, anything that interferes with the oxygen carrying capacity of the blood can result in more erythropoietin production, which can result in higher levels of red blood cells. Now, there are several things that could come into play. Athletes, actually, some of them will take EPO, um, which is a drug which will increase the red blood cell count, which means that during long distance things like a marathon or some other event, they have a slight advantage. Um, Being in higher altitudes, such as going to Denver, Colorado, where the air is so thin, you may develop more red blood cells, which gives you a greater oxygen carrying capacity. Now, to me, that means that if you are in an elevated atmosphere training and then you go to a lower atmosphere, you should be just like almost a Superman. So I don't understand how the Denver Broncos could ever lose a game ever, since they play at Mile High Stadium. But the other thing that can happen, as we said, anything that will reduce the oxygen carrying capacity will result in more erythropoietin, thus more red blood cells, and someone who smokes may have an elevated hematocrit as a result of this. Example that I know of, if you're familiar with Bob Newhart, who is a comedian. He's had a couple of series back in the 70s and 80s, and he was a 5 pack a day Camel unfiltered smoker. And he was not a guy who had like 4 or 5 cigarettes lit all over the place. This was a man who chain smoked 5 packs a day. He smoked through every single one of them. And one day he started not feeling well, and he went to his doctor, and the normal hematocrit is somewhere between 35 and 45. His hematocrit was close to 65, which was sufficient that it was really putting a strain on his heart. His doctor told him that if he did not stop smoking, he would die. So he went cold turkey off of a 5 pack a day habit, which made him, as I understand it, very pleasant on the set. Uh, anyway, polycythemia is a big strain on the body's systems. It does, for short term and in athletic situations, sometimes give an advantage. Some athletes have been known to actually donate their own blood, put it in storage, and have a transfusion of their own blood back just prior to an event, like a marathon. Um, Sickle cell anemia. Let's take a look. Well, let's take a look at the anemias in general. Um, there are several types. Hemorrhagic anemia, hemolytic anemia, any of a number of things that can cause a decrease in the number of red blood cells. So a sudden hemorrhage would result in hemorrhagic. It doesn't actually have to be sudden. You could have an ulcer that comes in there. Something that lyses or breaks down red blood cells. Specifically, if we look at hemolytic anemias, malaria can result in this. Bacterial infection. Vitamin B12, which is absorbed in the gut. Um, and for some people, particularly people who have something like GI cut down surgery, uh, you can have a problem arise. Now, vitamin B12 is a fat soluble vitamin, so it can take several years for the issue to show up. But when it does, you can end up with this pernicious anemia. Um, You can also get destruction of bone marrow due to different cancers, radiation, certain cancer medications, even a leukemia, which will crowd out the cells that make the red blood cells. And so you can have an aplastic anemia. You can have an inadequate hemoglobin content. This is usually a product of iron deficiency. The red blood cells are smaller than normal. They are pale because they lack the hemoglobin. You can have abnormal hemoglobin, and specific condition here is sickle cell anemia, and we will talk a little bit about that in just a moment. Nonetheless, what we have going on here is a cell that changes shape in such a way that it blocks blood vessels. And in fact, it looks something like this. And if you look at the cell on the left, you'll see a normal red blood cell. And you'll notice here that we have the sequence of amino acids that make up the protein that make hemoglobin. And it has valine and histine and leucine and so on. What can happen, this is actually a 146 amino acid long protein, but the number 6 amino acid, which is glucine here, can be replaced by valine here in sickle cell anemia. And that means that the cell, if there is insufficient oxygen quantity, or I should say oxygen tension, will change shape. And instead of being a nice round one that can pass easily through capillary beds, it becomes this sickle shape, which binds up and catches in the blood vessels, blocking the blood flow, thus starving the tissues of the oxygen that they need. Now, normally evolution would eliminate something that had such negative and deleterious effects. People with full-blown sickle cell anemia, they don't survive that long. They may make it into their 40s, but you have to have full-blown sickle cell anemia for this to occur. This is a recessive condition, which means that you have to have a gene from both mom and dad for this to happen. And so if the parents have a recessive gene, there's only about a 25% chance that their child would have full-blown sickle cell anemia. There is a good chance that they would have something called sickle cell trait. And both sickle cell anemia and sickle cell trait actually confer upon the person who has them an immunity to malaria. And this condition actually developed in areas that have malaria as where malaria is endemic. So equatorial regions, we see sickle cell anemia and we see malaria. Sickle cell trait causes the red blood cells to maintain their normal shape, but they leak potassium just a little bit, and the malarial organism cannot survive in a high potassium environment. And so the malaria organisms that reside in the red blood cells can't live in that environment. Sickle cell anemia, well, the red blood cells don't live that long because they change shape. They get destroyed as they pass through capillary beds. The cell membrane gets disrupted, and so their normal life expectancy is only about 90 days. But the microorganism for sickle cell that lives, or the microorganism that for malaria lives in red blood cells, and it has to take about 110 days to mature. So sickled cells never reach maturity, so the microorganism never reaches maturity. Or I guess more specifically, sickled cells don't survive that long, so the microorganism does not reach maturity. I mentioned earlier that it's a measure of oxygen tension. The cells don't sickle unless your oxygen saturations fall below a certain point. That's when the problems arise. And when it does happen, it can be quite painful. But we ended up with a very great jazz musician just because of this condition. You see, you can control oxygen saturations by controlling breathing a bit. And if you've heard of Miles Davis, well, Miles Davis had sickle cell anemia. And at a young age, his parents were told that they could help control the symptoms of sickle cell anemia if he would learn to breathe and they recommended that he learn a musical instrument, brass or woodwind. So he took up the trumpet. Uh, End result was that we have, many beautiful pieces of music done by this gentleman. Now, sickle cell, because there are blockages to the vessels, it can be quite painful, and it's not unusual for people with sickle cell anemia to be uh, hooked on pain medications, which Miles Davis was. Um, Treatment can vary. Having someone get on 100% oxygen, uh, rebreathing that to a point where their oxygen saturation gets back up to normal can be helpful. And blood transfusions are often performed with people with sickle cell anemia. Now, other conditions, other things that we can see, some abnormal conditions of white blood cells. And you should know these terms: leukocytosis, leukopenia, and leukemia. Uh, Leukocytosis, you have a white blood cell count that's elevated, and this can be just indicative of an infection. These are normal white blood cells, there's just a higher level of them. Leukopenia, you can have an abnormally low white blood cell count. Uh, Certain drugs will cause this, such as chemotherapeutic agents, corticosteroids, some other things that can result in a low white blood cell count, which can result in people getting an infection very easily. And then leukemia. And in leukemia, you have an abnormally high white blood cell count, but these are not normal cells. They just don't function properly. And so what you end up with is these non-functional white blood cells. Additionally, the cells that are making the white blood cells crowd out the ones that are making the red blood cells. Basically, the lymphoid tissues crowd out the myeloid tissues, and so you also get an anemia as a result of this, just an insufficient number of red blood cells. So, this last little bit talked about different conditions of blood. You should know the different anemias that you can have, the characteristics of each. You should know leukocytosis, leukopenia, leukemia, and what can occur with those, what those terms mean. Um, Hopefully, this presentation has been of some benefit to you. Thank you very much.